Universal Precautions and Standard Precautions, presented by Terry Lauren, Industrial Hygiene Consultant. Why do we have universal and standard precautions? Various body fluids, tissue, and blood may contain microorganisms that can infect people and cause disease. This may happen in workers caring for patients or in some way working with these organisms or human and/or animal specimens. With the AIDS crisis in the 1980s and 90s, new work practices, universal and standard precautions, and the OSHA bloodborne pathogen standard were put into place. What are universal precautions and standard precautions? Universal precautions is the practice of avoiding contact with human or infected animal bodily fluids by means of wearing non-porous articles. Also, the use of good hygiene habits such as hand washing, the use of gloves and other barriers, the correct handling of hypodermic needles, scalpels, and aseptic techniques. Standard precautions were evolved from universal precautions and are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient, in any setting where healthcare is delivered. Standard precautions branched off of universal precautions and body substance isolation. The medical industry fortified these concepts to deal with patients, so whether a medical, clinic, hospital, or dentistry, these procedures are now in place for those workplaces. What are the bloodborne pathogens? The most commonly considered bloodborne pathogens are HIV, AIDS, hepatitis B, and hepatitis C. Other organisms of concern are syphilis, malaria, delta hepatitis, hemorrhagic fevers like Ebola, brucellosis, otherwise known as undulating fever, tuberculosis, and there are 12 others that are also considered bloodborne pathogens. Tuberculosis is normally infecting via the respiratory route, but systemic tuberculosis can occur and fluids with tubercle bacillus can cause infection like these bloodborne pathogens. Where can bloodborne pathogens be found? They can be found in blood, blood serum, feces, urine, vaginal secretions, semen, cerebrospinal fluid, pleural, peritoneal, and other joint capsule or organ fluids, amniotic fluid, tissue, but not perspiration, sweat, or tears. What are the safety measures for universal and standard precautions? Appropriate hand washing and personal hygiene, disposal, care of contaminated items like needles, clothing, bedding, tissues, bandages, etc. Clean and disinfect environmental surfaces and the use of sterile instruments and devices. So proper sanitation and aseptic technique is what we're talking about here. Hepatitis B vaccination. PPE like safety goggles, medical gloves, face shields, lab coats, or liquid repellent protective clothing. Engineering controls like the use of biosafety cabinets. Universal precautions and standard precautions information on the internet. First of all, there's the CDC here, and this is about standard precautions. The next one is by the NIH, and it says it's a book, but it's a good little pamphlet about standard and universal precautions. The third one is also from the CDC. It's the Morbidity, Mortality Weekly Review, and there I have a little difference of opinion. They say feces does not have bloodborne pathogens. I tend to disagree on that. If you don't see blood, if you don't see pus or whatever coming out of a stool, then that does not mean that it does not have bloodborne pathogens. So there I have a difference of opinion.